She will admit.
Batson. And remember, this is
Yeah.
this is an interactive show. So if you have any questions for Dr. Batson, feel free to WhatsApp us on 299 for 103. Morning.
Hi, good morning, good morning. Let me say a pleasant good morning to you as well as the listeners of 103.1 FM. Always a pleasure to be in your company discussing health from a natural and integrated perspective. So, of course, as usual, we always have specific discussions as regards to.
That was a paid program. The view. All right. So I think we lost you there. Just need to adjust your mic, Dr.
Yes, yeah. Sorry about that. Good. Yes. So as I was saying, we always have an interactive program. Interestingly, hormonal imbalance is something that we often touch on. And today I'm going to touch on it again, simply because of the fact that all these women having problems with polycystic ovaries, fibroids, ovarian cysts, endometriosis. Now, we know hormonal imbalance causes a number of different problems. Infertility, it can cause problems with ectopic pregnancies. Just recently, we had a client who came to us for infertility, and they're now successful, thank God. So she had her baby last month, actually. So they came to us over a year ago, and that was one of the problems. The problems was actually a situation where they had had an ectopic pregnancy before. So essentially, they had one tube, because when you have ectopic pregnancies, it means that the fetus is basically lodged in the fallopian tube. Once it's lodged there, remember, it is a growing organism, so it's going to grow and grow. And of course, once it runs out of space, it's going to damage the tube. Hence the reason it is referred to as ectopic pregnancy. The thing is, any hormonal imbalance challenge, polycystic ovarian syndrome, endometriosis, adenomyosis, fibroids, ovarian cysts, painful menstrual cycle, irregular menstrual cycle, all of these are as a consequence of hormonal imbalance. So, of course, the question is, how do you balance your hormones? Naturally, that is. And that's one of the things we do at Batson Associates. So, I'm going to quickly introduce you to two products that we carry. Of course, keep in mind your diet is fundamental. If you can put in some exercise in there, it's even good or better. Hydration always is important. That's something I focus on a lot, because I tell people hydration is everything. So if you're not drinking sufficient amounts of water, you're already in problems. Good. One of the products that we carry is a product known as Uterine Plus. Now, Uterine Plus actually before that used to be called Cyst and Fibroid Formula. Now, the reason why we decided to change it is simply because a lot of women would say, well, I do have cysts, I do have fibroids, so that product is not for me. So we wanted them to understand the product is designed for uterine health in general. So the health of your uterus, the health of your ovaries, proper hormonal balance, actually balancing estrogen. Because the problem with fibroids is that once your estrogen levels are high, your fibroids will continue to grow. Right? Once you have that imbalance with progesterone, estrogen, you find that you're going to have that challenge. And that is one of the things that the Uterine Plus does. There's also another product that we carry, which is known as Women's Formula. And we primarily use both of these products together, maybe with some other things, depending on what your situation is. Like, for example, if you may get someone who has low blood count, and you usually find women who have severe problems with excessive bleeding, endometriosis, adenomyosis, they would usually have issues associated with uh, polycystic ovaries, fibroids, ovarian cysts, painful menstrual cycle. So that is one of the things that the product actually does. It helps to balance the hormones themselves, fix the endocrine system, which is the thyroid, parathyroid, pituitary, adrenal, the glands that is responsible for the production of the hormones. So that once the hormones are balanced, your issue with polycystic ovaries, fibroids, ovarian cysts, endometriosis, and the like, they're going to be a thing of the past. So feel free to give us a call or visit. Keep in mind that if that is your situation and you're coming for us to actually address it, you would have to do the live nutritional blood cell analysis and the magnetic resonance analysis, simply because those would give us an opportunity to assist you and help you in correcting the situation over a period of time. That's very, very important. Of course, abdominal pelvic ultrasounds, as well as if you would have done MRIs or CT scan of the abdomen, of the uterus, make sure and work with those. So those telephone numbers that you can get us on, you can get us for the head office, which is in Chaguanas. Montrose Main Road, Chaguanas. That telephone number is 222-8261. That's 222-8261. And for Debe, Debe is the corner of Ramsamut Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515. That's 223-7515. And keep in mind that we do have an open clinic day this Saturday in Debe, where yours truly, Dr. Batson, would be there. I actually worked Debe Monday and Tuesday, and that was quite good. I was in Chaguanas yesterday. And of course, we will be in St. James on Friday, and Debe is going to be Saturday, please God. But we have other open clinic days, so you can feel free to call, visit. Let me say a pleasant good morning to Miss Elizabeth Nanlal, as well as Miss Melissa Richards, Miss Kamala Samaru, and so many others who have joined us on the live. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. Over to you, Karen.
Yep, we have 2 questions for you. So we'll go with the first one, low blood count. How can you help with low blood count? This got so bad, according to the listener, they almost ended up in hospital.
Okay. We could deal with low blood count. Let me say a pleasant good morning to Miss Pearl Prasad. Thank you so very much. God bless, and I hope you're having a safe and pleasant day. Mr. Clifton Henry, good morning to you as well as Miss June Jatta. And she says, blessed morning, Doc. We are locked on. Yeah. So the thing is, you have to understand that when you have excessive hormonal imbalance issues, you're going to have a problem with bleeding. And it means that you're going to have low blood count. What is low blood count? So low blood count is an indication or a test that is done to determine the percentage of different aspects of the blood itself. So they will look at CBC, or what is referred to as your complete blood count. Now, a complete blood count is going to look at a number of things. It's going to look at your white blood cells, your red blood cells, your hematocrit, and those type of things. So if you have a problem with low blood count, where you know you're always lightheaded, you're always dizzy, that is something we could correct. The advanced chlorophyll inflammation formula, that's something that we use, Optimizer as well. So we could actually design a protocol diet-wise that is going to actually help you in naturally boosting the blood count. The problem with a lot of persons, sometimes in boosting the blood count, you will be given iron tablets. I am not a fan of those, simply because iron by itself can cause problems in the body. In nature, iron never comes by itself. Well, nothing in nature comes by itself. For example, bananas would be high in potassium, but bananas don't only have potassium. There's a number of other things that have different vitamins, minerals. So the same apply to what we're referring here in terms of actually addressing that whole root cause of the problem. So it means that you have to look at it from the dietary perspective. And of course, as I said, you have to do the blood analysis and the magnetic resonance analysis scan. So what we want to do is, in building the blood count, we're actually helping the body to produce red blood cells. That's what you want to know. And that is what that particular protocol is going to help you to accomplish. Okay, what was the next question?
All right. So the other question, what causes fibroids?
Well, fibroids, as I said, is caused by hormonal imbalance in the body. You have 5 different types of fibroids. You have you have intramural, you have pondulated, you have subserosal, and 2 others. So they're primarily given the name based on their location. Fibroids are as a result of serious inflammatory response in the uterus and the ovaries. Hence the reason I was talking about the uterine formula. Because what that product does, as I said, is basically clean and detoxify the uterine cavity. It helps also with balancing of the hormones, because once you have fibroids, your estrogen levels are excessive. You have too much estrogen. There are different foods that could contribute to excessive estrogen. Lifestyle can contribute to excessive estrogen, especially chicken. We know the chicken that we have has a lot of hormones and antibiotics in it, so that does contribute to a situation. So if you have fibroids or you have a hormonal imbalance challenge, it means that chicken is something that you should deviate from for a while. Try and use more fish. Of course, your fish should be steamed, grill, bake. If you are doing, you have things like turkey you can do as well. Again, steam, grill, bake. So because you want to remove as much inflammatory food from the diet so that we can actually bring down the inflammation and keep the inflammation down. Once inflammatory response is high in the body, you're going to end up with problems in that particular area, the uterus. So every single female who has a problem with menstrual cycle, whether irregular, painful, spotting, excessive bleeding, endometriosis, fibroids, polycystic ovaries, adenomyosis, they tell you have cysts, whatever your challenge, infertility, you have excessive inflammatory response in your organs associated with your sexual reproductive organs. And that is one of the things that we do at Batson and Associates. So again, feel free to give us a call or visit. Those telephone numbers again are 222-8261. That's 222-8261, as well as the WhatsApp is 314-9975. That is 314-9975. Again, if you have any questions there on your side, Karen, you could always let me know.
So listeners, you have a question for Dr. Batson, feel free to WhatsApp us on 299-4103.
Good. Keep in mind we are live on our social media. We are Batson and Associates TT on Instagram. So let me say a pleasant good morning to Miss De La Hennessy, Miss Elizabeth Nandlal, the real Jamel James, Babe 2093. Pleasant good morning to you guys. One of the things as well too, someone is asking a question as regards to thyroid. Does thyroid contribute to problems with fibroids? Yes, it can. We found when you look at the endocrine system, we realize that your pituitary gland is actually the master gland of the body that controls the adrenals, the thyroid, the parathyroid, and all those other organs and organ systems. So it's very important to maintain proper endocrine health. But of course, if you go back further as to what would cause hormonal imbalance, you always end up in the aspect associated with gastrointestinal, which is very, very important. So if you're a female and you have problems with acid reflux, bloating, gas, belching, constipation, the likelihood of you developing a hormonal imbalance issue and having things like polycystic ovaries, fibroids, ovarian cysts, endometriosis, adenomyosis is significantly increased if you have a gastrointestinal problem. So keep in mind that gastrointestinal health is very important to all other aspects of health in the body. We have a question.
What do you think about laser therapy to treat sciatica, knee pain, and inflammation?
No. Me personally, if it's me, my body, no. And the reason why I don't like it is because in last resort, we have no other choice in the matter. Good, no problem. But you see, the issue with most people is that they wait until it's too late to address certain things. And I'll give you an example. Most women who end up with hysterectomies, a hysterectomy is the surgical removal of your uterus. If you do a partial hysterectomy, they'll remove the uterus alone. If you do a total, they'll remove uterus and the ovaries. Now, we have to understand that if a female has a hormonal imbalance problem, that problem didn't come overnight, you know. She would have been having that problem for years. The problem is most women, one, don't know how to deal with the problem because you go and you take birth control. That just makes it worse. Regardless of what birth control you take, it's going to make it worse. Good. And then with that now, what you find is that with that worsening situation, you have waited so long now that your body is in a state of emergency. Because the thing is, if your blood count is 5 or 6, and you constantly bleeding, the doctors are left with no choice in the matter. Of course, they have to consult with you, but you're now in an emergency state. So it means the doctors have no other choice but to perform a hysterectomy. And most of the time, you're going to get a total hysterectomy because doctors will try their best to give you a partial hysterectomy. But sometimes you have so much rubbish, for want of a better expression, in the uterus. The uterus is referred to from a sonographic perspective as bulky, which means the uterus, if it's supposed to be, let's say, 2 inches in diameter, your uterus, is 9 inches in diameter. So it has a lot of bulk. It has a lot of things that are not supposed to be inside of there. And you could also have fusing of the intestines. There are a number of problems or a number of things that could go wrong in that particular situation. So, ladies, if you know you have fibroids, if you know you have polycystic ovaries, if you know you have hormonal imbalance, don't just sit down and say, well, it's not bothering me right now. Believe me, it is going to bother you. It is going to bother you. It's just a matter of time. And the thing is, as I said, don't leave it to the point where it gets so bad that you're reaching a point where you do not have a choice in the matter, because that's exactly where you're going to end up. In order to preserve your life, the doctor's going to have to do a surgery where they have to remove key organs from your body. You don't want that, or well, at least anybody with sense doesn't want that, because you're going to end up in problems. I mean, I don't have to explain to women how uncomfortable it is to be bleeding outside of your cycle. That's uncommon. Women within the cycle is be annoyed. 5 days, 7 days. You can imagine if you're bleeding for 30 days, you can't go anyway. You gotta be changing pad. Your clothes always mess up. I mean, the list goes on. Your ladies know what I'm talking about. My point is this: if you have an issue like that, you have to nip it in the bud as early as possible, because if you don't, it is just going to get worse. It is just, and the thing is, it's going to reach a point where the possibility exists that even medicine can't help you. Because I have known of situations with women, those fibroids got so bad, they started pressing organs, started pressing on your bladder. It started press on your intestines. I remember dealing with a client when they came to us, they actually ended up with endometrial cancer because of the amount of issues that they have. And the thing is, very quickly, women have to understand, if you compare like your grandmother, your great grandmother, those women long ago had a way they used to clean themselves, they used to do like vaginal steaming. They used to do like they would get like things like hog plum, especially after pregnancy. Women deliver children, they would stoop over hog plum bush, bacano bush, and those type of things. The reason that they did that is so that all that clot blood and everything would come down there and come out of the system, because you don't want clot blood in your system, obviously. That's going to cause problems. So a lot of women who have larger ovaries than normal, or larger uterus, or a larger uterus, a bulky uterus, is because you have a lot of clot blood inside of there. A lot of toxins, issues associated with fat deposits. So that's going to create a whole big problem inside of there. So feel free to give us a call at Batson Associates. That telephone number again is 222-8261. That's 222-8261. And of course, our location, first floor, Money Talks Building, Montrose, Chaguanas. We have a next question.
Well, it's the same listener, same texter. So back to the laser therapy. What about laser therapy that one should be aware of?
The thing with laser therapy, remember, laser essentially is heat, fire, for want of a better expression. With laser therapy, you run the risk of damaging nerves. So if your nerves are damaged, you're going to be in some problems, especially as a result of surgical procedures, whether it's laser, whether it's surgery, or what is referred to as minor surgery. You have to take into consideration those things can damage the nerves. And once the nerves is damaged, you could be in some problems. A number of issues, problems with urinary incontinence, for example. So they might do a laser surgery, and depending on where they do perform the laser surgery, subsequent to that, you could end up with nerve damage that actually affects the way you urinate, affects certain things. So, as I said, you always want to do the least invasive procedure first. Look at your diet, look at your lifestyle, make the necessary changes, and then look at the results that you get. So very quickly, because I know our time is very close. Yes?
So here is a question for you. Can you help with a diabetic ulcer under the foot?
Yeah, we can, definitely. Under the foot is a little tricky because, I mean, it's under the foot, and remember, so you'll have to watch how you're walking and that type of thing. But we have dealt with diabetic ulcers quite successfully, so definitely we can help in that situation. So again, you have been listening to Dr. Jason. Sorry, yes, two?
Yeah. Just two more questions
All right, good.
for you. Do you treat slip disc and sciatic nerve problems?
Yes, we do. We do that. We do treat both of those as well. So
And that's at all locations?
All locations. All locations. Good. So again, that telephone number for head office, which will direct you to any of the offices. That telephone number for Chaguanas is 222-8261. That's 222-8261. And the WhatsApp is 314-9975. That is 314-9975. As we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless. And to all the listeners of 103.1 FM, do enjoy the rest of your day. Keep in mind our open clinic day as well as our testing specials. And again, you can call that number 222-8261 for additional information. Thank you so very much for your time. Karen, always a pleasure to be in your company. Until next week, God's willing, take care and enjoy the rest of your day.
Thank you very much. You've been listening to Dr. Jason Batson, supporting health naturally. This segment with the good wishes of Batson and Associates. That was a paid program. The views expressed within were not those of 103.1.
Yes, social media family. Again, a pleasant good day to you, Miss Marva Huggins, Miss Jazzy Janice Innes. She says, good morning, Doc and viewers. Checking in from Staten Island, New York. Okay, great man. Miss Kathleen Ishmael, don't think the good Lord has to send help only through a priest, but this program is truly help from above. Blessings, Doctor, and blessings to everyone. Thank you so very much, Miss Kathleen Ishmael, better known as Mother, eh? You know, that's mother to all, eh? Ms. Leslie Ann Clifford, she says, morning, Dr. Batson. Good question on sciatic nerve problem. Yeah, the thing is, let me just quickly go. When you're dealing with sciatica, keep in mind, because your spinal column is your core. So the spine, your diaphragm, this aspect here, your core, is essentially important in dealing with a number of different things in the body. Balance is very important as it relates to your digestive system. The thing is, but your bones are the warehouses for calcium. Remember, your bones comprise of calcium, magnesium, and phosphorus in the form of calcium phosphate. So if you have problems with acid, your body is going to undermine the spinal column and take a lot of calcium and interfere with the bones. And that's how people end up with degenerative bone problems and degenerative disc and degenerative disc and all the long list. It is because those organs are not being fed properly. The nutrition is missing. And that's one of the things that you have to work on. Ms. Abigail Danielle says, bless you, Doc. Thanks so very much. So, guys, keep in mind, we have two programs today, God's willing. We have, well, yeah, two additional programs. So we also have 106.5, which is Freedom, and that is from 1:15 to 2 p.m. today. And we also have DJ Mamu Radio TT.com, which is going to be from 2:15 to 3:15. So we'll be going live for those two programs, so you could join us. And again, of course, if you have any questions, keep in mind we do have iOptics formula. We have our Santulan, we have Alkagen water, we have gotten teas, circulation tea we have in abundance. We have cholesterol tea, we have joint teas, hypertension tea we should have. I know we're getting back hypertension and prostate. We have male teas, we have liver, we have kidney, some really, really good teas. So that's something you could take advantage of and get some benefit. Nerve restore. If you have a problem with sleep, if you want to improve your sleep, improve your whole mental attitude, things with depression, anxiety, relax. If you have a lot of stress, this is a product that naturally helps to reduce cortisol levels, hence reducing stress and inflammation in the body. So again, you have been listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. So take care, guys. God bless. And remember to join us again at 1:15 to 2 on Freedom 106.5 FM, where we'll continue our discussion on health. God bless. Do enjoy the rest of your day. Take care.